Um, Hi everyone. I think we do have a great noon and welcome in our summer learning series 2025. So the topic of this summer learning series is the culture of care, embracing root, elevating practice. And then this summer learning is sponsored by our Maine pediatric behavioral health partner in collaboration with MCD and the Department of Health and Human Services. So the purpose of this learning series, first of all, is designed for Maine healthcare provider and care team, including community health worker who support patient and family adapting to the new care system and then environment or cultural context. So the session will be focused on building practical relationship-central approach that strengthen communication, trust, and continuity on care across clinical and community setting. And then we already have more than 4 sessions, and each session have a specific focus. Some it's serve family who are new men here in, and other one is fostering in meaningful interaction across cultural background, and other one is strength, trust, and communication in clinical and community care setting. So first of all, we need to acknowledge, and the project is funded by Maine Department of Health and Human Services, Office of Behavioral Health, through the Pediatric Mental Health Care Access. And the grant was supported by ERSA, what we call Health Resource and Service Administration. And we want also to acknowledge that this learning is developed and delivered by MCD Global Health in collaboration with Maine Pediatric and Behavioral Health Partnership. So today, I just want to go a little bit in our housekeeping. All participants are muted. The webinar is being recorded as we need to share the link for someone who will not attend this meeting. And you could have a live transcription if you want in another language than English, like, so you need to go in the more, or if you did not see the more in your bar, you could just go in the 3 dot and you will see the caption and you could just click there and you will have the translate in the language. And then also, if you have any question, you could just type in comment the question that it's like directly to our instructor or to speaker. But if you have a technical issue, please go in the Q&A button and type the kind of issue you have. Maybe it could be sound, it could be a video. And if you did not hear what the speaker say, or you did not follow well the video or the slide, just please go in the Q&A question and type there. And also at the end of this presentation, we'll have a little poll. It will take maybe 2 minutes and it's kind of evaluation. Please answer to all of the questions. This is our last session. So please, we want your remark to improve our maybe next session who will come. And then this webinar is in partner, we have a partnership with Department of Health and Human Services. We have a Maine Pediatric and Behavioral Health. We have a Global Health, MCD, who provide us a platform and all of this device. And today we have a new partner who provide us a speaker. It's a new Maine Public Health initiative. And then I don't want to take more time. I just want to present you a little bit our speaker. The topic of the day is enhancing early development support in Maine, who will be presented by Ibo Omer, who have a master in public health for University of New England, and she's also affiliate faculty and public health at New Hampshire, Mainland. And she's a co-founder and executive director of New Manor Public Health Initiative. So, Ibo, you have a stage and you could just start. If you want to add something in your presentation, go ahead.
Thank you so much. Good afternoon, everyone. My name is Hibo Omar, and we can go straight to the PowerPoint. Thank you. Yeah, the topic today, as you guys heard, is enhancing early development support in Maine. A very exciting topic that's very dear to me. The next slide. About NMPHI's early support, what is it? Since our beginning, this was something that we saw in the community, supporting family through early intervention, especially empowering moms on a cultural responsive approach to foster growth in the children's development and empowering family as well to navigate the system. Next. Key features of support. As we know, cultural responsive approach is really very important. And for many of the new Mainers who come to the new land, understanding their background when serving the family is very helpful, and tailoring the support for to foster trust and improve communication. Because many time the entry point is very important. Early intervention techniques, mostly, as we know, for children under 5, the earlier they are catched and kind of see if something is needed, the better it is. And that kind of also, for the long term, help the child. I think someone can't see. Okay, I don't know. Technical Excel. Is the PowerPoint or?
I can see the
Yeah,
PowerPoint.
I can also see the PowerPoint too.
Yeah. We are seeing your PowerPoint.
Okay. And what is it? At least that is really kind of helpful from the beginning, and kind of also there are some screening in place, and how can that screening be utilized, and strategies, mostly families kind of early identification of developmental delay, allowing and immediately taking action, what is it, for the child. But first, I always say that we have to kind of, family have to buy in that the child need some kind of assessment before the child can get assessment. And that's really the hardest part. And as providers, we really have to kind of give parents as well a time to process what was told for their children. Next slide. And then what is it? If we kind of break down, identifying, not one glove fits all, every new Mainer family is a bit different. So identifying the difference of the family during assessment, and many culture also, the milestone is different, and then recognizing that uniqueness is very important. And as parents are the first, in Somali, we say parents are the first university. Many families need to be engaged, and provider need to give family time to build trust and have that relationship for the assessment to be done. And also providing other resources that is tailored to the family. Each family maybe is different, so kind of having that humility and that approach. And then embracing the community change, because as providers, there are limited time that you will have with the family, but empowering the family to seek support through other communication, to be advocates for their children, so that the child can have the best assessment and support. Next. And this is a quote, what is it, that I strongly believe in, because one of the, together we can break the stigma and support our children. The provider as well as the parent have the same goal, it's the child, but mostly with artificial disagreements, they lose the focus. And that's really important because the provider want to help the child, and the mom, there is no mom that in her sane mind will not would not want what's best for her child. So having that interest and having that goal that is uniting them will take them long and kind of have the assessment done than the artificial thing that they, families kind of, and the provider focus on. Next.
So I think the next slide is a video. I just want to play that video for you.
Okay.
As a student and an on-call interpreter, one day I was meeting a provider in front of a home. I met the provider, we knocked at the door, and someone opened the door for us and called down the person from upstairs. We were sitting on the sofa when the woman arrived. As an interpreter, I introduced myself and the provider. The woman's child is suspected of developmental delay and so was referred out to a specialist by his provider. Once I started to ask about the targeted child, the mother asked us to leave her home. I was in shock and did not know what to do, but ended up interpreting what the client's mother was saying to the provider. I left for the day to my 9-to-5 job and came back home that evening. I was cooking dinner and getting ready to feed my kids when I heard a knock at my apartment door. I opened the door and it was the woman I visited this morning who kicked us out of her home. I was surprised and did not know what to do. So I invited her in, and now she was sitting in my living room. She started to ask me questions like, why were you at my home? Why the provider needed to see the child, and who gave you my information? I had no answer. I let her know that I will find out in a couple of days. So I gave her my number. The next day, I called the provider to get clarifying information about the questions the client's mother wanted to know. I realized an important thing that day. The new Mainers, parents, and the primary care providers are not on the same page. Vital information is lost in translation. I was never the same in my personal life and with my career choice after that. I became a catalyst and a change agent. My career path changed from that moment on. I found my purpose in life. I had to learn about diagnoses and disabilities. I became an advocate for the children with special healthcare needs and disabilities and their parents so that they can seek early support to their children with special health needs. I started seeing children with disabilities in the community who are kept at home without services due to fear and taboos. I feel that parents have the right to know about the special needs of their children, but also need time to grieve on their own with the new diagnosis. Without knowledge is without light.
Yeah.
As you guys, as you guys can see in this video, what is it? Back then, I was an interpreter that kind of went into a home, and it breaks my heart that these kind of situations still happen after many years. But at least with the help of CHWs, my hope is this will change and we can move the needle, because many interpreters, someone called me from Portland that I didn't know. And then the person I was meeting, I had no idea who they were. I just met them. And then as an interpreter also, no one prepares you of things that will happen in a situation. Yet that mom later on kind of used to say, if only I could have got that help, if only, but then regrets don't help. When parents are in a shocking moment of, let's say, because many of us, we come from a place where disabilities are seen, they are taboo, it's like, and kids don't get any help. And then we have this vast support and services, yet fraction of the people are using it. And it breaks my heart to see that children who could in their lifespan could get a better future, just like their other siblings, could get a chance in life, are kept at home. And many research show us that the first 5 years of the children with special need, if they get the services that are needed, their chances of navigating, and having an employment, or it will be higher, it will be better, because it's just they think differently. That different way are also through research and books have been, it has come a long way. Yet the new families and new Mainers are not using that. And as providers, we really have to kind of go above and beyond to support the community. Knowledge is power. Knowledge is really, that's a Somali proverb. In Somali, it's called "Aqoon la'aan wa iftiin la'aan." Without knowledge is without light. So the new Mainer families are walking through a tunnel, and we have to be that light at the end of tunnel, cheering for them and supporting them, because the moms that have children with the special need that get the encouragement and the support the first day that they see a provider, the outcome is different. Those moms they see the light at the end of the tunnel because someone showed them that there is a light. This child may not be 100% as your other child, yet they can have an employment. They can do so many things. Maybe they can speak, but always go and search and find those resources. So those parents, they bite on to that idea, and they are eager, non-stop, to find that services, to always take that child to the appointment and support the child. So, and one of the things that I'm part of is that luckily, alhamdulillah, I was lucky enough to be in a part of LAND. LAND is, it's a program that is offered in UMA, University of Maine in Orono, sorry. So it's leadership in education for neurodevelopmental and related disabilities. And what it does is it trains the workforce to enhance expertise in leadership and skills to practice for families professionally. So, and I, like each year, I'm lucky to kind of install the idea that when parents come through your door, please be that light at the end of the tunnel, show them. And cultural humility is really important, because one glove fits all doesn't work. It has to be, we have to be, cultural humility goes longer. So, but yeah. Oh, thank you, Zakia. Yes. And at least that is my presentation. But if you guys have any question, anyone who work with families, because I strongly believe that when families come through the door, it's really, they are jumping hoops and loops to get to you that appointment, because the closest family members are not accepting that idea. You know, if the husband is in the household, it starts from the husband. There is this, the naysayers in the community are a lot. So when moms get to the door, capturing and kind of increasing and showing them the campus to guide them and to support the family is really very important.
Yeah. So thank you so much, Ivo. Ivo asked if we have any question. We open a discussion. So if you have any question, yes, Zakia.
Hey, well, sorry, I'm gonna be off camera because I've been eating lunch and I don't want to subject everyone to that. Great presentation. I wanted to just ask because in a lot of the conversations that I've had with parents of kids who have been diagnosed with developmental disabilities, especially in the New Mainer community, as you talked about, there's a lot of stigma. You know, there's challenges with sort of accepting diagnoses. I was in a conversation with a parent a few months ago. They were telling me how she didn't believe that the diagnosis was accurate because they had determined that her child was autistic because she had been walking on her tiptoes, and that was one of the telltale signs. And she felt like the evaluation should have been more thorough. In that sense, receiving that diagnosis, her child has been having difficulty with like childcare since she needs specialized childcare, and the services are very overloaded. And so I wanted to ask, in conversations with parents where that the diagnosis is hard to accept or understand, and maybe the services and resources aren't up to par, how can community health workers sort of help them through that process of understanding why the diagnosis happened and how to sort of accept it and move through the process, as difficult as it may be?
Yeah, thank you, Zakia. It is that the entry point for any kind of services is that diagnosis, and many parents don't accept in that fact that the child needs support, you know, by TP, you know, and those are is the mom ready or the family, you know. Most of the time you see parents who deep down know something is wrong with the child, but because people who are around them are saying there is nothing wrong with the child, they accept that and make their truth. But if they have previous children, and you know, the number is also increasing in new Mainers. I don't know why, but the reality of it is, mom, any parent you can ask, if there is something wrong with the child, parents know. But then it's that accepting it takes longer. And many times I used to think it's just a problem among new Mainers, but it's a human problem, because you see many mainstream Americans who also are in denial. And then I was surprised. I'm like, you can read, you can go and research, you can do this. But then it's that reality that acceptance is not there. But as hard as it is, CHWs should not be tired of just telling them the signs and the symptoms, because they live with the signs and the symptoms and the problem they see as that child have. Autism doesn't make sense, because even in English language, when you say autism, it doesn't tell you anything. The only language that really capture what autism is the Arabic language. I was surprised because it's called tawahud. It means the loner, loneliness. It's one part of it, but it shows that it describes something. Whereas autism doesn't say anything. And in Somali, it's autism. There is no word for it. So recently, they were working on a word to describe, because there are so many kids who are being diagnosed that the educators came together and said, we need to name this thing that is affecting our children. We cannot keep saying autism, autism. We have to have a word, a Somali word that anyone can relate to. And it's tough. And every language should also figure out what can be named, because there is no description for it. But yet, when parents are disputing those who went, the knowledgeables who were supposed to diagnose, then you see there is a problem. That mom will be, quote unquote, non-compliance, because she will not take that child to appointments because she doesn't see that this child need any help, or she won't take that child to PT or OT or anything. It's like any problem that child have, that mom will not follow through. She doesn't believe what the provider is telling her. So it's kind of empowering the mom that deep down she needs to search and find the correlation. Okay, why everybody kind of put their whole foot on the ground? Why is this happening to my child? Rather than, otherwise it will be pull and push. No one is right. It's like, and then for the job for the CHW is being that buffer, empowering mom with knowledge, empowering mom with things that are, that she won't have otherwise, with her own language. And then after time, she might come closer and accept it to get to better that child's life, to a better position for that child, to get some support for that child. And as providers also, once the information are given to them, they are left on their own. And it breaks my heart that, it's like, okay, connect them with someone or something, so that parents can also go through the process of grief. Grief has a process. We know that. We can't just say, people cannot jump out of that grief. They have to go through that process. For the child, and the child don't have time. Imagine the time is ticking and that child is growing. It won't stay at that same place. So it's really a work that is, as a group and as a community as a whole, that we have to kind of carry each other and be cheering for parents who have special need, a child with special need. I hope I answered it, Zakia.
Yes,
thank you so much.
you.
I see here we have a comment and question in the chat. First of all, Jennifer say, I agree 100%. I was there myself a long time And then my youngest child loved this presentation. So, and then we do have another question. So I don't know if Christina would just unmute and then repeat her question.
Yeah, thank you so much. I'll unmute. And thank you so much, Hibo, because I think I'm reflecting on your comment about language and how that, we know that language is important. And if there isn't a word for it that different communities can understand or have that or identify a diagnosis, for example, with autism that you're using, it's important because as we try to think like, okay, how do we make sure that people have resources? But if there isn't a word that that communities recognize, I think that's important, and I thought that was a powerful thing to reflect on as we as health providers like think about what does education look like, and if we don't have a designated word for a community, that makes it a lot harder. So thank you for that. But I also I wanted to ask about what about in the case of providers, right? So yes, community health workers are that connection, that bridge, and we take that education and certainly find ways that people will receive the education. But what are some respectful ways that providers can ask families about child development practices in their culture? Like if it's a provider, a medical provider, what is a respectful way they can ask during their first session, or as if they're coming in for an appointment? Like what do you recommend that providers can inquire about the cultural views around developmental practices?
Yeah, no, that's really a good question, because what is it? As you know, there is this poster for milestone in the United States, the normal milestone, and in many cultures that exist as well. But there are some nuances that are really opposite. Like I remember feeding children, for example, as simple as that, or dressing, activity of daily living, ADLs, in different cultures. For feeding, a Somali mom, for example, the first time I saw a video of many culture feeding their kids, I saw the European culture feeding was the child was given a food on a high chair, and that child made a mess. And here I was, I didn't even know I was talking out loud. I kept saying, where is the mom? Where is the mom? Where is the mom? And then everybody was surprised. And and later on, the teacher has to intentionally pick me and say, wait, you kept saying, where is the mom? Because culturally, in Somali culture, moms are there to feed their children. Mom is there to dress the child. Mom is there. And then, but in European culture, that is the opposite. And I saw that firsthand because I used to go in schools, and I see many of Somali kids, especially, they can't tie their shoes. And I would say, oh my, and luckily my kids were much younger. They were in school age. And I would say, oh my, and as a sub, I cannot go help that child. And I will say, and grinch, they can't zip their jacket because of course mom zipped this morning that jacket, and they're always can't feed properly themselves because mom fed them this morning. And I used to literally see the importance of early on the European system of just making that mess, because that child will have enough time to make mistakes, and by the time they're 5, they will learn how to do these things at 6 and 7 and 8. But our kids start late because of that culture, because moms strongly believe that it's their job to feed the child. It's their job to clean after the child. It's their job. But, it's like, and I used to say, well, I like this American way because you early on, you're teaching the child the independence of doing things on their own. And when they are in school, they will be able to do it. And that's why cultural humility is really important, because culture plays a big role. Is the new Manor mom wrong? No, she's not. She is 100% right. Is the European mom wrong? No, she's 100% right. But then we have to find that sweet spot of what can we do to help the child to succeed in this life? How can we change the mind of the mom who thinks that just like back home, she needs to do everything on her own. It gives her time. She will take a break, for crying out loud. But we have to take that message that she's teaching the child a lesson for a lifelong learning, that he will grow or she will grow into it and get better at it as they grow. So I hope Christina answered that question.
Yeah, I think it's really helpful, and I like your example, because I was thinking about, my partner's Ethiopian, and the culture of food is eating with your hands, right, and using that flatbread, that injera, and so yes, there is definitely that, like, the parents feeding. And there isn't utensils as we're used to in the European model, as you talk, or Western, or the USA. And so now that the child just started pre-K, one of the things that they had to change before starting pre-K was for the child to be able to use a fork and a spoon, because they needed to be able to do that before enrolling. And that was really interesting, because I said, yeah, well, it's not part of your culture. And so there's that. So if culture humility definitely plays a role in always, asking more questions to it. So thank you for that.
That's good. Thank you so much, Ibo and Christina, for clarification. So before to take the question of Nelila, I just want to read a couple comments here. Dr. Richard say, great meeting. Thank you for invitation. And Loretta say, the former director for the community care team at Northern Light Health is now the new director of autism of Maine. I think, Ibo, you need to be in connect with this kind of person. So Nelinda, you have a stage and you could ask your question or your comment.
Thank you, Axel, and thank you, everyone. I apologize too, because I'm having my lunch, so I'm off camera. But I just wanted to basically, Christina, you raised almost all my questions and my points that I was planning to just highlight it. But the only thing that, in addition to what you may already say, I strongly believe, I'm not the kind of person that likes to do, like, takes action immediately. and by hearing this, it made me realize that I also know people, at least I know one person who is a professional, and her son was diagnosed with autism, and she literally didn't want to believe the diagnosis. And in fact, she moved back to her country in Africa. So that was really sad, right? So by hearing this, it reminded me that a situation, and I feel like, based on I came late to the training too, but not too late. But I hear enough, and based on what I hear, made me realize that it's still need a partnership with, yes, we can train the child. I mean, the child can provide resources, but the child are no experts in this field. This field is very unique. It has a lot of challenges in just the condition itself. Yes, it's need for community support, family support, and there is cultural competence needed, but we need to partner with, and I'm glad that, Axel, you just read that we have a provider that specializes in this. Let's invite that person, let's partner with him or her, and as a state, we can come up with a plan that is very comprehensive. We need to do a lot of work, because that's not going to happen in 1, 2, 3 meetings. No, we need to do focus group. We need to tailor it by communities. But this condition, it's increasing, and it's getting out of control as a supporting community, if you will. It's getting out of our hands. So I believe this is a perfect time that we can come up with strategic interventions, that we can tailor approaches to the specific communities, but with the support of experts in the field and CHOWs. That's it. Thank you.
That's good. Thank you so much, Nelida, for the great intervention. I think we have a next step for this one. I don't know if we have another question before to jump in our another slide.
Yeah, I just want to add something, Nalida, thank you so much. What is it? There was a time that Autism Society of Maine used to come to NMPHI and teach moms. And one of the things that kind of early on caught my attention was out of almost 12 to 13 moms, all of them either knew someone, because we didn't want to also target people who the question was, do you know anyone who had do you know of in the community and in general, any family who have children with autism? And all of them knew someone, either neighbor, either a distant family member or something. And that was a while back, and it was surprising to me that, it's like, oh my God. And then the reality is that when they went through the process of teaching us, lights, as they were talking about lights bothering them or flashy thing bothering them, and many were saying, oh my God, I know that, I know a child who does this. And I kept saying, the person who was supposed to finish one PowerPoint in one afternoon kept coming again and again, because the conversation was so alive. And people wanted to know more about each slide that she presented, about signs and symptoms of and things that kind of trigger things. It was, an ongoing, that it was Saturdays that luckily I was very grateful that the person used to come in on a Saturday for us, because normally they work from Monday through Friday, but she will especially make time to come and teach the parents. And it was really an eye-opening, and we really need experts on this topic.
Yeah, that's correct. So I don't know if someone have any question, or we could just check. So if we did not have more question, we just want to say thank you.
I want to add something. What is it? I just want to say that after many years of families who have children with special need in the United States, there are really some kind of highlights that happened in the Somali community a while back. A mom who had a child many years ago, maybe 30 plus, I think. And the way, it kind of gave a lot of moms the energy, so to speak, because that mom didn't have any knowledge or anything, but then she was a professional, but she left her profession to care for that child and to seek and do anything and everything for the child. But then the outcome was amazing. That child became a professional in IT, and he got married and everything. And during the period of the marriage, many people found out that he was, quote unquote, categorized as an autistic child. And then the narrative changed 360. But then mom was interviewed, and one thing that really she kind of hit the nail, it's like to kind of calm the community, was like, my child was like every child, born in 9 months. I didn't choose that child to get autism, but yet when he got it, she left everything that she has and kind of focused on that child. until he succeeded because he was in the high functioning side of it. But then numbers was much easier for him. Memorizing, his memory was really amazing, she said. And then she kept pushing until he got into a university level, because many of the parents in the new Mainers don't believe that the child has a future once the child has quote unquote special need, because their mind just work differently and depending on where they are on the spectrum. And that's something that many parents need to know regardless, because even those who you think are in the lower side of it, their brain is amazing, because I was lucky enough to work with many kids, and then they know when I come that they need to leave. And it used to surprise me, because the African mentality is like there is no hope. And here is the child grabbing his shoes. And I used to wonder, why does he have his shoes again? Because he knows that we're leaving. And, their mind is exceptional, so to speak, because I always feel that in the lane of normal, 25 miles per hour, theirs is already in 55. So I sometimes really feel that we are the ones that are slow, because their brain is much faster than us and much in higher speed. Therefore, teaching parents to enjoy where the child is young, to learn with them, it's a new way, it's a new discovery. Therefore, don't miss, so that parents don't miss with agony and anger and negativity, because in New Mainers family these days, it's not only one child, sometimes it's 2 or 3. And I tell parents that God has chosen you, because the higher power can give you only what you can handle. What you cannot handle, you're not given. Therefore, encouraging parents to kind of enjoy the ride, because these children will grow to be adults. How can they be self-sufficient? How can they, and parents will not be as strong as they are today. So kind of preparing parents to that journey, the long journey that's ahead of them.
Yeah, thank you so much. Nelly, I don't know, you raise again your hand? Or
Yes,
no, okay.
Just a clarification for Hibo, previous to this last statement that she made. Just wanted to make sure that Hibo, when the strategic proposal that I made, I meant for state-wise, because yes, programs have worked with specialists in the past. My program has worked also, but I believe that we need a better strategies as a statewise, of that is statewise, that each organizations can adapt it, and can benefit from this approach, because one, it's more effective, and then second, people are in and out. They always are moving. So if we come up with a strategic plan that is statewise, it's more effective, and we have new people now, definitely, and new providers, and we have more data now than 10 years ago. At least it has been since I work with in this field with a partner. Thank you.
Yeah, that's good. Thank you so much, Nelida. Thank you so much, Ibo. So we want to go in our next slide, who is a Maine Pediatric Behavioral Health Partnership. So because we talk a little bit more about Maine Pediatric Behavioral Health, we want just to highlight something about it. The mission of the Maine Pediatric Behavioral Health Partner is to educate, support, and empower pediatric care provider and the clinical team member through training and ongoing web-based and telephonic patient care consultation with behavioral health provider. The Maine Pediatric Behavioral Health is available to register provider and practice for all children and family, regardless of insurance or financial status, and it's free of charge. So I think I will put like a web link in the chat, and you could just contact them to 833 partner MPBH, like the phone number is there, 672-4711. And then this is our last webinar online. And for the next event, I just want to give stage to Christina. She could talk a little bit more in depth because it will be in a couple of weeks. Christina?
Yeah, it's quickly approaching it. This will be next Friday. I firstly want to thank Hibo for joining us and bringing this great conversation. And as Nelita was talking about, like, this isn't a conversation that we can solve this in one conversation in 6 webinars, or it's an ongoing work that we are seeing. And so I was trying to add a flyer, but I'm not able to, so I'll share a link. But we're having an in-person event that wraps up the series that we've been having. And so the name of it is Embracing Roots and Elevating Practice. Well, this is the webinar series, but the event for next week is Rooted Conversations. And so how can we strengthen care delivery through shared dialogue? And what we're going to have is a World Cafe style workshop where we're going to talk about these different topics that are health topics in the community, and bring together community members, community leaders, bringing different health providers and care teams, which includes CHWs, but also, in the health system, there's pharmacists, dentists, physicians, nurses, caseworkers, social workers, that are all part of this network that we of the health system that we are trying to get the community to be part of, right? And so it'll be in person in Lewiston at the public library from 9 a.m. to 1 p.m. And so I believe, not sure if Axel's just shared the link, but I just reshared the link to RSVP for this event. It is going to be a smaller event because we want these meaningful conversations. Of course, we're not going to solve problems there either, but we're going to start conversation as to what is needed and what steps can we all take in connecting folks. And hopefully we'll have some great productive conversations from there, tools and skills to learn and take home. We'll also have a networking lunch provided as well. So we'll have a light breakfast and a lunch. And so we hope that you can sign up and join us next Friday. Axel's over.
Yeah.
Back to you.
That's good. Thank you so much. And at the same time, I launched a poll for you. Please try to answer this poll. You have you could have 2 minutes. Scroll down, it's just a couple 6 questions in this poll, and let us know what is the topic you would be interested in, couple short and word. So here it's our contact. If you want to have more detail or just have update about the session, this is our email, mcdzoomtape@mcd.org. You could just send us an email, or if you want, you could just send to me directly an email to my MCD email directly. I will just try to answer to your question, but this one is general. You will receive answer for all of our team. And then, as Christina already underlined, we wait you on our in-person event. It will be in Lewiston in library, and I think it's still a couple number, 2 or 3 to finish our evaluation. But thank you so much for your time to attend all 5 webinar series. It was 5 great weeks. We share, we laugh, we learn. That is the goal of MCD and our partner Maine Pediatric, and we have the Department of Health and Human Services. I think for the close word, I return the word to Christina.
Yeah, no, thank you so much, everyone. Thank you for sharing your time with us, and we hope to see you Friday in person if you're able to join us in Lewiston. Thank you all for joining us.
Thank you.
Bye.